A biopsy pathology report is one of the tools a physician uses during a prostate cancer consult. I sat down with Dr. Kreitz recently and asked him to explain to us why the biopsy pathology report is so important, and here's what he had to say.
Well, the biopsy report, by the way, that's the report from the urologist, from the pathologist. When a patient has a biopsy sent to typically from his internist to the urologist because of abnormal PSA, has this stuff, his needles in his prostate, and find this cancer. And the most important thing about a man's cancer is the biopsy report, particularly the Gleason score. That's a number between 2 and 10. It tells us how extensive, how aggressive is the cancer. That's the most important thing about a man's cancer. And also, how many needles show cancer. Typically 12 needles are used, 12 needle sticks of a man's prostate. How many of those have cancer in them? And what kind of Gleason scores are there? And all these other things. But that's the most important thing about a man's prostate cancer, and that's what we want to see in writing, so we make certain that what we're talking about is correct. We always, however, want to have that biopsy report double checked. Not that we're saying bad things about the pathologist who looked at him, but we don't know anything about their skill levels. And the biopsy report, as I said, is the single most important thing about a man's cancer. We want to make certain that it's absolutely accurate. So what we'll do to that patient that we talk to is say, let's double check your biopsy material. Not to have another biopsy, but have the material sent to us, and then we send it to expert pathologists whom we do know, we've been working with for 20 years, and have another reading on it.
The physicians at RCOG can offer second opinions and cure rate probability projections to men who have recently been diagnosed with prostate cancer. I recommend requesting our free guide, Questions and Answers About Curing Prostate Cancer. Complete the form or call us and I'll mail you a guide and DVD right away. I'll also send you a link to my full interview with Dr. Kreitz, which I think you'll find both interesting and helpful. And be encouraged. Prostate cancer is a very treatable disease. The key is to educate yourself and get multiple opinions from doctors who have great reputations. I wish you the best in your journey.